Hello everyone, my name is Matthew Maloney, and today I will be doing a presentation on the issue of alcohol and drugs, as well as the strategy of early intervention in the communities of Aboriginal and Torres Strait Islander people. Drugs and alcohol are a persistent issue in the Aboriginal and Torres Strait Islander communities, and to start off, a deeper look into alcohol-related health issues and outcomes provides a valuable insight into the detrimental effects of these substances. Firstly, we start with the facts about consumption in regards to lifetime risk and single occasion risk. Lifetime risk is determined to be consuming 2 standard drinks a day on average, while single occasion risk is determined by drinking more than 4 standard drinks during one occasion. During the 2012 to 2013 study by the Australian Bureau of Statistics, it was found that roughly 18% of Aboriginal and Torres Strait Islander people aged 15 and over consumed more than 2 standard drinks per day on average. This is a 1 in 6 ratio of people vastly exceeding the lifetime risk threshold for health complications. As for single risk occasions, 54% of the Aboriginal and Torres Strait Islander people had consumed more than 4 standard drinks during said occasion. These numbers are an average for the 2 genders, with males significantly and consistently being the higher number. As an example, 77% of Aboriginal and Torres Strait Islander males had consumed alcohol in the last year of the study, compared to females at 68%. There is also the comparison to non-Indigenous people regarding this study, where the only age group to exceed the Aboriginal and Torres Strait Islander numbers is 15 to 17-year-old males. Only one age group in one gender exceeding the percentage, and only by 4%. These numbers are solid evidence that alcohol is greatly affecting the Aboriginal and Torres Strait Islander community. The numbers shown by this single study alone are concerning, especially due to the health-related impacts that excessive alcohol consumption can have. The health issues for lifetime risk drinking include high blood pressure, heart disease, stroke, liver disease, digestive problems, various types of cancer, including breast, mouth, throat, liver, colon, etc., weaker immune system, memory problems, mental health problems, and alcohol dependence. Each and every one of these health issues has an increased likelihood of affliction with exceeding consumption guidelines of more than 2 standard drinks a day on average. As for short-term health issues, these include personal injuries from inebriation, such as falls, burns, motor vehicle accidents, etc., increased tendency for violence, alcohol poisoning, miscarriage, stillbirth, or fetal alcohol syndrome disorders for pregnant women. Short-term health issues arising from excessive occasional consumption are much more likely for those who exceed the 4 standard per occasion limit. However, due to the social aspects of Australia as a whole, exceeding this in the age range of 15 to 25, these limits are often far exceeded. Alcohol alone has shown an interesting yet disturbing reality behind substance abuse, and while this can be attributed to the ease of access in acquiring alcohol, other substances also show concerning numbers. For this presentation, drugs are tobacco, pharmaceuticals, as well as other illicit substances such as cannabis, methamphetamine, heroin, etc. The key findings from the 2016 study of Aboriginal and Torres Strait Islander communities regarding drug use by the Australian Institute of Health and Welfare include statistics from 2019 such as 43% smoked regularly, roughly 25% used an illicit drug, just under 1 in 5 smoked cannabis, 7% abused pharmaceuticals, and 3% used various amphetamines. As you can see, the substances consumed in the Aboriginal and Torres Strait Islander community have varying levels of use, and these numbers are statistically higher than the non-Indigenous population, tobacco being the prevalent drug in the community. Now, looking at the health issues associated with each type of drug. Tobacco. 1 in 5 Aboriginal and Torres Strait Islander people live with someone who smokes indoors. Smokers had a median of 10 cigarettes a day. The health issues include various cancers such as mouth, throat, lung, etc., heart disease, and a stroke risk increase. Amphetamines resulted in a damaged brain, damaged cardiovascular system, psychosis, and malnutrition. Opioids included lung damage, such as respiratory damage, liver damage, and cardiovascular damage. The health detriments are numerous when looking at regular and even occasional substance use, and the fact that Indigenous peoples are at a higher risk of using and abusing these substances is evidence enough that something needs to happen. And that something is early intervention programs. Early intervention programs address a wide variety of issues such as crime, drugs and alcohol, and the like. How early intervention programs work. Early intervention programs focus on getting to people before the associated issue becomes too developed and requires acute treatment. In other words, attempting to stop the issue before it becomes one. This also helps in the matter of preventing one issue, also prevents the same issue from stemming into others. For example, preventing alcohol abuse also helps prevent social struggles and physical and mental health struggles. While knowledge is a key component in the intervention program, strengthening support groups of those at risk is also a major part in the process. These protective factors can look like maintaining positive familiar relationships, enjoying and completing school, positive role models outside of the house, such as teachers, coaches, etc., and living in communities with lower levels of drug use. This is known as primary prevention. These strategies are at a close level of contact with people who are at risk. Secondary and tertiary prevention is also part of the process, where secondary prevention is identifying risk factors and screening for early detection and treatment. And this helps prevent the issue from becoming a disorder or illness. While tertiary prevention is treating conditions and preventing reoccurrence. This is the last step in the prevention process, as it is essentially treating the condition and looking at how the treatment can be improved upon. These early intervention strategies are implemented by the National Indigenous Australians Agency through the Indigenous Advancement Strategy. The success rate of these programs vary depending on what kind of strategy is used. An example of an ineffective strategy would be the use of smoking cessation and nicotine replacement therapy, such as nicotine patches and health advertisements. These two strategies, although targeted towards Aboriginal and Torres Strait Islander communities, were found to be less effective due to the implementation being rather broad and less personalised. While intervention strategies centred on providing information to the youth through schooling and strengthening positive support groups and positive role models were found to have better results. This strategy can also be evolved significantly through schooling in the manner of teaching through the 8 ways of Aboriginal learning, or through positive role models by having elders come into the school to be the authoritative voice that has cultural weight behind it. In conclusion, alcohol and drugs is a prevalent issue affecting the Aboriginal and Torres Strait Islander population, with the overwhelming majority of both age and gender groups of Indigenous people being in a higher percentile of use compared to non-Indigenous. The early prevention programs have a quality of depth and adaptability that can be easily expanded to help those in need now more than ever. The support of the Closing the Gap initiative and continued research is positive progress towards a lower percentile in the Aboriginal and Torres Strait Islander community.